same symptoms of chest pain and discomfort that are in a man are very different in women. And it is something that has been under-recognized by the medical community. Fortunately, through the American Heart Association and researchers, we've come to find that. And it's events like these that where we can come and educate everyone here about heart disease in women in order for you guys to go to your doctors and press them and say something here is wrong. And so that is why I'm here today. So half of women who present with a heart attack never had a prior warning symptom. And more women than men who have sudden cardiac death had no prior symptoms. Women with heart disease and strokes have a worse prognosis than men. And women are treated differently. If you take a look, women that end up in emergency departments and they're diagnosed with heart attacks, they're put on less aggressive medications. They're not referred to cardiac rehab. They're not treated the same way as men. And we have now again come to realize this, and it's very important for us to continue to push, and women should receive the same treatment as men. So here's a list of all the risk factors for developing heart disease in women. Smoking, diabetes, high cholesterol, high blood pressure, being obese, physical inactivity, having a family history of having early heart disease, so less than 65 for women, less than 55 for men, having depression and stress. Now there is sex-specific risk factors, preterm delivery, gestational hypertension, preeclampsia. So while you're pregnant, if you have high blood pressure, protein in the urine, all of these are markers, and having gestational diabetes. Again, having diabetes while you're pregnant puts you at significantly increased risk for having heart disease, and that is very under-recognized. The American Heart Association actually came out with a scientific statement because more than half of women use their OB-GYN as their primary care doctor, and they go to no other doctor than their OB-GYN. So it's very important for women to bring up any of these risk factors with their primary care doctor, if not their OB-GYN.